don't have restrictions for the sake of restrictions. I've always said that we have tried to use restrictions as a last and limited resort, not as a first and maximum tool. And every restriction has negative consequences. Collectively, all of these restrictions, enduring over a long period of time, have negative outcomes in terms of people's emotional and mental well-being. And sometimes that is expressed, Rick, as you know, in very serious ways. I mean, let's not put our head in the sand about the emerging data on a decline in child mental health and emotional well-being during the COVID era, with all the dislocation, separation from their friends. Let's face up to the significant increase in addictions and opioid overdoses, which I think is rather obviously connected to the anxiety and dislocation of the COVID era, the restrictions that have been part of it. Let's look at the data about increased family domestic violence and spousal abuse and so much more that lies below the surface, but we all know about in our lives. And so we just have to be mindful of that. The notion that we could just, cancel Christmas in an excess of caution for the second time, where grandchildren can't go and see grandma and grandpa, where siblings can't join their aging parents. It's the notion that we should do that in an excess of caution, I don't think reflects what Albertans would be willing to tolerate. So we're trying to balance these things. There's no perfect way of doing it. We are concerned about Omicron. We should be. Dr. Hinshaw has given a very clear message today about how people can take voluntary measures to keep themselves safe. But at the end of the day, that's what it's about. It's about 4.5 million people making individual choices that are responsible. That's basically what we're asking for here. We're giving them parameters. They are very stringent parameters, but we're trying to make them reasonable in a way that people can realistically follow them after 21 months of this. If the situation changes significantly for the worse, we will take action. As we have, we will take action to protect the healthcare system. We are in a particularly challenging moment with Omicron, because we know some things about it, but there's not yet a clear scientific consensus about the threat that it may pose in terms of severity of outcomes and therefore pressure on the hospital system. What we do know is it is highly transmissible, and it is here. There will undoubtedly be widespread transmission of Omicron. Because it's more transmissible than Delta, I think we can reasonably predict that it will become the dominant variant in the province. What we don't yet know is what kind of threat that might pose on the healthcare system. We need more data. I can tell you that in my discussion with all 13 premiers last night, that none of them are prepared to move forward with a significant additional stringency in their public health measures. They all were of the view that the Canadian public is more or less at the limit of its tolerance for public health measures, that adding stringency right now, just before Christmas, the second COVID Christmas, would invite widespread non-compliance, and that we must all work very closely to monitor the developments on Omicron, and we will take tough decisions if they are necessary to protect the healthcare system. But this is all about trying to strike a balance, imperfectly. There will always be critics on both sides of that balancing exercise. But if the message here today was we're canceling Christmas, stay at home, you're not allowed out, and we're putting a cop in every corner, I think people would tell us to take a hike. They're not going to observe that kind of stringency. So I think this is you know, this is a call for people to be responsible with very clear parameters. Alberta's maintaining some of the most stringent COVID rules in the country because we are being very cautious, but we're also trying to balance it with all those other factors.